There's no money in prevention. There's no money in prevention research, which is why prevention has not gotten to be a bigger part of the equation when it comes to healthcare policy, healthcare reform. The reason why our free market approach was put to the wayside, not with Reagan, but with Bush 1, Bush 2, Clinton, why Obama wouldn't even look at it, is because the lobbyists had complete control over what was advanced and what was pushed to the side.
Let's get into my interview now with Dr. Dave Janda. How did you get into this whole world of government as an orthopedic surgeon? And then next thing you know, you have all these contacts in deep government and in, media and all those things. How did you transition into that?
So in one word, it was actually an accident, and it was completely unintentional. My background, I grew up in Chicago, went to college at Bucknell University in Lewisburg, Pennsylvania, got degrees, majored in chemistry and economics, then went to Northwestern University Medical School in Chicago, got my MD degree, internship and residency at the University of Michigan, then did my fellowship in Canada in shoulder reconstructive surgery and sports medicine. But the actual real part of it, I did that as a fellowship, but I got a huge training in national healthcare policy. That was unintentional. So I had an indication of actually, which has served me now over the past several decades as this country has moved from a private practice type of healthcare implementation program system into unfortunately, more of a VA national healthcare type system, a la Obamacare, and we'll get into that obviously. But so I was minding my own business, if you will, practicing as an orthopedic surgeon. And in addition to my work in orthopedic surgery, I also had a special interest in research. And I had two avenues of research. One was developing operations to help people after they were injured. But something completely different was my work. I had some experience in prevention, trying to prevent people from getting injured in the first place. And I ended up being a lead author of a number of different published studies in the peer-reviewed medical literature that focused on prevention, which should not be the exception to the rule. There should be a lot of research in prevention, but there's very little. There's no money in prevention. There's no money in prevention research, which is why prevention has not gotten to be a bigger part of the equation when it comes to healthcare policy, healthcare reform, your doctor talking about prevention issues at your
It should be, and I don't mean to interrupt you, it should be what our government taxes. If they're going to spend any money, I mean, it should go towards that versus anything else, but go ahead.
Right. Prevention should be emphasized in many different respects, from the research side to the implementation side to the routine visit side. It's not. And it's because there's no money in it. Okay. So, but my work in prevention actually led to me getting involved in government. So one study that we focused on was this injury pattern that was occurring in sports. And I was told at the university at the time, hey, Dave, and this is the University of Michigan, Dave, just take care of these people after they've been hurt, okay? Just stick with that. So I did stick with that, but I also focused on the prevention side. And we did a very elaborate study, and actually we found, Sarah, that by making one little change, we could prevent 95% of folks getting injured in that sport and save 99% of the healthcare costs. Well, the Center for Disease Control in Atlanta contacted me and said, hey, send all your data down to us. We want to look at this nationally, run some analysis. And they concluded, based on our study, that if this one change occurred, it would prevent 1.7 million people from getting injured every year in the United States and save $2 billion every year in healthcare costs. Now, here's the note. We spent $1,000 total on that study. And it prevents 1.7 million people from going to the doc or going to the hospital every year and save $2 billion in healthcare costs. And that's not the exception to the rule in prevention. It is the rule. A very small outlay in expenditures has a significant reduction in morbidity and in injuries, in disability, in healthcare costs. Well, what happened is that study got picked up by the what I call lamestream media, which was still mainstream back then. They'd still had some, I think, some semblance of integrity at that point. Well, it got picked up by a number of different TV outlets, Today Show, Good Morning America, CBS This Morning, CNN, and the papers, Washington Post, New York Times. Well, Ronald Reagan was president at the time, and he reads an article about this. So I'm in clinic seeing patients, and my nurse comes to me, and she goes, Dave, yeah, there's a phone call for you. Well, phone call? Well, can we just want to take a message, and I'll call him back. No, not this one. What? It's the White House. C. Everett Koop and Jack Kemp, who was a congressman at the time, was working on domestic policy issues, and myself were working on health care reform to make the system more available, more affordable, more quality oriented. And here's where it gets really sad, Sarah. When Koop took and emphasis on prevention and wellness, when Koop took this information to Reagan, he prefaced it by saying, well, President Reagan, the insurance companies, big pharmaceutical companies, and big medicine, the AMA, are not going to like this because it creates a free market system and empowers people rather than insurance companies, big pharmaceutical companies, big medicine. And here's his response. I don't care. I don't care. If it helps people, I don't care who gets mad. Just push. So what happened was, Sarah, is that Koop and Kemp and myself were pushing this agenda, this free market agenda. And things were moving along. And then, as I said, it was at the end of the Reagan administration, Bush kicked in, Bush won. So Koop presents and Kemp presents this information to Bush. And now Kemp is Secretary of Housing and Urban Development. So he has even more power, presents this to Bush, and old man Bush says, I don't want to upset insurance companies and big
While
guys,
his lip service was always free market. He talked about free market all the time.
Right. So it wasn't just, hey, read my lips about the tax thing. It was read my lips about free markets too, right? So it gets deep sixed. It gets shoved to the back. Okay. So now Clinton comes in power. And some folks contact me and go, hey, we understand you have some stuff on healthcare policy, and Bush didn't listen to it, but can you help us and can you talk to us about this? So I present the stuff, and Clinton's response was, well, we don't want to upset the insurance companies, big pharma.
Because they paid too much for our campaign.
Right. So whether it was old man Bush or Clinton, it was the same. Well, now Clinton's out of power, right? And who comes in? George II. Well, same stuff. Janda, you got this information on healthcare policy. Can you? Same response. We don't want to make these other people mad. Well, and Obama, forget about it, right? Because Obama was tied into Obamacare from the very beginning. Obamacare was written by the insurance companies. I know people out that window in the People's Republic of Ann Arbor, Michigan, don't want to face that fact. But Obamacare enriched the insurance companies because the insurance companies wrote, paid for, implemented Obamacare. All you have to do, Sarah, if you want one metric, look at the stock prices of insurance companies when Obamacare kicked in. And if you look at February 2009, which is when the stimulus bill passed, you look at the stock prices of insurance companies in February 2009, and you look at it now, they're up 600, 700, 800%. The reason why our free market approach was put to the wayside, not with Reagan, but with Bush 1, Bush 2, Clinton, why Obama wouldn't even look at it, is because the lobbyists had complete control over what was advanced and what was pushed to the side.